So, Shannon, can you tell me a little bit about Geisinger's program for texting? Because I know we talked about that last year, and maybe you can tell me how it's progressed.
Yeah, I think we've seen some exciting results from text messaging, and it's something that hasn't been talked a lot about at the conference. Mm-hmm. Somebody tweeted about it yesterday and said, don't forget about text messaging, and I want to echo that. It's probably on the simpler side of solutions. Mm-hmm. But we did a very nice weight management program, a 12-week program for patients, and we found that patients that participated in that program actually decreased their BMI about a half point more than non-participants. And if you were female and in the 40s, it was a 1 point decrease greater than non-participants. So for us, that was pretty significant. We're also using it with appointment reminders, and that's going well.
How did it work? How often did you text?
We did 3 days a week, Monday, Wednesday, and Friday, and they were a combination of motivational messages, nutrition, activity, as well as reminders to log their food or take their weight.
Wow. And so you're continuing this program and maybe adding some other texting?
Yeah, so we did that as a pilot program, and so we've now made it available system-wide. And we've been doing appointment reminders, and that's really, the pilot program showed about a $50,000 reduction in cost for no-shows, so that's been rolled out system-wide. And we're pursuing a more dramatic medication reminder program. We've also got something going on with hepatology for hepatitis C that we're looking to do, and so I think it's a really nice area to explore for clinical needs, because it was relatively simple to put forward as compared to a lot of the projects we do.
Right. So I'm thinking it's one of those projects that could be replicable. That I was thinking other health systems. I know you're, among the top, but even small rural health systems could implement something like that.
Yeah, it's fairly low cost.
Yeah.
You buy a short code if you've got volume, which can be $10,000 to $15,000 a year, but it's 1 cent a text or 2 cents a text.
Wow.
So it's not a very expensive program. It's something you can do on a smaller budget.
And what else would you like to update us on, or perhaps something new that you've started?
Hey, I wanted to just mention the mobile app space. I mean, when we talked last year, we were just getting into it, and I was looking at a cardiac rehab app, and it was kind of the first thing we were doing. I've now really gotten a very good look at the market. It's more complex than I expected it to be. I think the market's dominated by a lot of general health apps, diet trackers, nutrition, weight. And from my perspective, that's an area where the consumer can kind of navigate on their own and figure out what device has the best features for them. And so where I'm really struggling is back to the chronic condition. How do I use it for asthma or COPD or a cardiovascular disease, diabetes, something like that? And so I think we all fully believe that apps are the way to go with the patients.
Yes.
But how to get the right app and get it tested has been more complicated than I thought. I've looked at a number of vendors. I'm having trouble finding exactly what I want, either from a functionality perspective or a price perspective. We are going to do a little bit of build our own.
I was going to say, then perhaps you'll have to build it.
Yes, and so all the application development vendors may be happy about that, because that's where we may ultimately go. But it's been more a complicated space, and that's one that really does require integration with the medical record. The text messaging could kind of sit outside of it, and that complicates it too, because if I'm going to need to track and communicate blood pressure or heart rate or things like that, I need to get it into the provider so they can look at it. And at least from a Geisinger perspective, we work best when things are integrated with the medical record.
Yes, for everyone. Yeah. So at Geisinger, you do have a app building team?
We have an excellent group of IT folks that are interested in exploring this area.
Oh, that's great.
I'm not sure I can completely call them an app development team, but we've had a great IT team to work with us to say, look, we need to be in this space.
Right.
Let me go out there with you, Shannon. Let's understand requirements. Let's pull something together and see what we can do.
But after this, you will have an app development team. All right.
I think we will.
Thank you very much.
All right. Thank you, Bernie.